Hello everyone, today I'm going to present a case of cetuximab-induced aseptic meningitis. Cetuximab is an epidermal growth factor receptor inhibitor typically used for the treatment of metastatic colon cancer as well as head and neck cancers. Although it has shown to have survival and quality of life benefits for certain group of patients, it has also been associated with some adverse effects including skin reactions, fatigue, diarrhea, nausea, as well as abdominal pain. Today we're going to talk about a case of cetuximab-induced aseptic meningitis. Patient is a 57-year-old with metastatic colon cancer coming in after receiving his first dose of cetuximab infusion. Patient reported to have chills during his infusion and subsequently developed a fever, neck discomfort with numbness, frontal headache, nausea, and vomiting a few hours later. In the ED, he was found to be febrile to 101.8. He was found to be tachycardic. Cold sepsis was subsequently called in the ED, and the bacterial meningitis was suspected due to positive meningeal sign on the exam. Patient was started empirically with IV vancomycin and meropenem to cover for the source of infection. Labs was not notable for any leukocytosis. Patient received a lumbar puncture, which shows a CSF study with dendrochromic appearance. White cell count was found to be elevated in the 800s range with 83% of neutrophils predominance. His glucose was 66, which is slightly elevated, and his protein was normal to be at 62. CT head was unremarkable. Due to the cold sepsis situation, an extensive infectious workup was performed. A blood culture, CSF study, CSF meningitis, and encephalitis panel, as well as cryptoantigen tests were all obtained. Patient subsequently became afebrile on day 2 and remained afebrile for the remainder of his hospitalization. After culture remained negative for 40 hours, IV antibiotics were discontinued, and patient's symptom continued to improve and resolved on hospital day 3, and patient was subsequently discharged. Due to the limited treatment options for his cancer, patient decided to continue with cetuximab and tolerated subsequent cycles without recurrence of cetuximab-induced aseptic meningitis. This is an interesting case because it is important to distinguish between bacterial etiologies as well as aseptic etiologies of meningitis. Here I compiled a table to compare some of the common etiologies between bacterial, viral, fungal, and tuberculosis meningitis. So for bacterial meningitis, typically the white cell count is found to be quite elevated with a mean of 800. It is found to be neutrophilic in predominant. Proteins is found to be quite elevated between 100 to 500. Glucose is found to be low, typically below 40, and the gram stain is typically positive with a sensitivity of 60 to 90%. For viral etiology, the white cell count is found to be elevated, but not as elevated as bacterial etiologies, with a mean of 800, found to be lymphocytic in predominance. Proteins between 30 to 150. Glucose is not as low as bacterial etiology, typically between 30 to 70. Gram stain is typically negative. For fungal etiology, white cell counts is found to be mean of 100, lymphocytic in predominance, protein from 40 to 150, and glucose from 30 to 70, also gram stain negative. For TB etiologies, white cell counts mean of 200, which is lymphocytic in predominance as well, proteins above 50, and glucose below 40. The AFB smear is typically positive in 40 to 67% of the patients. Although many etiologies can cause aseptic meningitis, as I talked about, viral, fungal, and tuberculosis, it can also present as a usual drug reaction, typically involving NSAIDs, such as ibuprofen, antibiotics such as Bactrim, as well as other agents such as IV immunoglobulin. 2 mechanisms of action have been proposed so far, including a delayed hypersensitivity type reaction and a direct meningeal irritation. Typically, with the other medications, once aseptic meningitis is to be developed, this medication should be avoided in the future as aseptic meningitis can recur. And to our knowledge, there are only a few cases of cetuximab-induced aseptic meningitis in the literature. And in these cases, interestingly, the CSF studies typically have a neutrophilic predominance resembling that of bacterial etiologies. Therefore, extensive infectious workup needs to be performed, including blood cultures, urine culture, chest X-ray, and most importantly, CSF studies, even in cases of suspected aseptic meningitis. Here we present an interesting case of aseptic meningitis in a patient with metastatic colon cancer as a rare self-limiting adverse event that occurred within 24 hours of the first administration of cetuximab. And most patients, even with a history of aseptic meningitis due to cetuximab, often tolerate weight challenges without any development of any meningeal symptomology in the future.